All right, everybody, we're here with Dr. Brendan Higgins, one of the providers in sports medicine, and he focuses a little bit on hips and adult hip reconstructions. And we have a few questions for him, very pertinent at the moment, because we just heard news about Tuukka Rask having his injury and a torn hip labrum. And from somebody like me who doesn't quite understand all the little nuances that go into it, I thought it'd be great to have Dr. Higgins here to talk not necessarily specifically about that Tuukka Rask case, but about hip labrum tears in general. So thank you, Dr. Higgins, for joining us here. And so let's get kind of just the basics out of the way. What exactly is a torn labrum in your hip? And then what kind of movements does it restrict, but also what kind of movements does the labrum in general allow?
Well, Matt, thanks very much for the opportunity to do this afternoon. I appreciate it. And also just to reiterate what you said, I have no involvement in Tuukka Rask's particular injury or his surgery or treatment plan, and just want to make sure that we're very clear about that. In terms of kind of what the labrum is and what a labral tear is, the labrum is a soft tissue structure that encircles what's called the acetabulum, or the socket of the hip joint. I spend a lot of time in clinic talking with my hands kind of like this. And if you can imagine the hip socket looking like this and the ball of the hip joint sitting in that socket like this, the labrum sits on the edge of the socket. It's what's called fibrocartilage. It's kind of similar to the tissue that you have on your earlobe. And it surrounds that socket, and it serves to deepen the socket a little bit. And it also serves to hold the fluid that we naturally have occurring in the hip joint that lubricates the hip joint, what we call synovial fluid. It serves to keep that fluid in the joint and not allow it to kind of slip out to the rest of the body. And it serves some roles in stability of the hip as well. But one thing it has is it has a lot of nerve endings in the labrum. And so when it's injured, it can tend to cause a lot of pain for people. Typically, to address your second question in terms of when or what activity or what motion typically causes injury to the labrum, it's usually hip flexion. So I'll kind of demonstrate back here, but if I were to stand up and I bring my knee up like this, when the knee comes up and up towards your body, up towards your chest, that really can serve to kind of pinch the labrum a little bit. And that's typically the mechanism by which labral tears occur.
Interesting. Okay. And so I guess from my very general knowledge of these things and what you're saying, it's kind of like almost like a washer. I've been mentioned about, like, kind of holds everything together, make sure everything's tight, but also gives a little bit of ability to move. Is that?
Yeah, that's a great analogy, Matt. Now, yes, in many ways it does serve a function similar to what a washer would do.
Okay, great. And something that in the medical world that I'm very familiar with is a slap tear in the shoulder. I tore mine about 8 years ago now. Is that kind of similar? Because that's another labrum up in your shoulder. Is that similar to what you were talking about with the hip, or are those very different?
So, in many ways, they're very similar in terms of kind of the anatomical features and where those two structures are. They are somewhat similar. Just as the labrum surrounds the socket of the hip joint, there's also a socket in the shoulder joint. The socket in the shoulder joint's a little bit flatter. It doesn't kind of encircle the shoulder, the ball, or the humeral head, what we call it in the shoulder joint, such as it occurs in the hip rather. And so there is a labrum in the shoulder as well. And a slap tear is a tear of the superior or top portion of the labrum in the shoulder joint. The mechanism, however, tends to be a little bit different. We typically see slap tears oftentimes in overhead activities, overhead athletes, people that are pitchers or quarterbacks or javelin throwers or tennis players or that sort of thing. And oftentimes it occurs more because of a pulling type mechanism, the what's called the long head of the biceps tendon, which is one of the two biceps tendons, comes in and attaches on the top of that labrum in the shoulder. And oftentimes that labral tear or slap tear in the shoulder occurs because that biceps tendon pulls a little bit on that anchor. And the hip, it tends to be a little bit different. There's nothing attaching onto the labrum akin to the biceps tendon when we're talking about the hip. And so it tends to be more of kind of a compression type injury. As that hip flexes up, the labrum gets pinched in between the femur or the ball and the socket, or what we call the acetabulum. And that concept is termed femoroacetabular impingement. Femoro meaning femur, acetabulum meaning socket, impingement meaning those two are hitting each other and causing a pinching and eventual tearing of the labrum.
Gotcha. Okay. Well, that makes a lot of sense actually to me, surprisingly. Can you maybe explain a few different kind of common ways, like the normal Joe would suffer this kind of an injury?
Yeah, so, this is typically not a traumatic injury. Labral tears actually tend to be much more of a chronic injury that occurs over time. And most commonly, it's because people have a little bit of abnormality with the bony structure, the bony architecture of their hip. And without getting into too much detail, if we go back to the ball and socket here, if you have a socket that is a little bit too deep, so let's say this is a normal socket here, let's say your socket instead kind of comes like this. And when you go to flex up, that socket is going to hit that ball earlier than it would in most people. On the other hand, you can also have a perfectly normal socket, but instead of, let's imagine that's actually a round ball. Instead of having a round ball, if you have a little bit of a bump on the ball, can hit the socket, and that also can cause the labral tear. And those are the two kind of most common causes for this condition of femoral acetabular impingement, which then leads to labral tears. We call that bump a cam lesion. And I suspect, and as I mentioned before, I have no involvement in the Tuukka Rask situation, but he's kind of the prototype for somebody that probably has a cam lesion and a labral tear. Those are much more common in men, and hockey is probably the single most common sport for having cam lesions and labral tears. On the other hand, when we talk about that socket and the deep socket, we call that a pincer lesion, and that's much more common in females. So again, not knowing anything about the specifics of the case, my suspicion would be that Tuukka Rask likely has a cam lesion. And actually, he's even said as much that this has been something that's actually been going on for quite some time. And that's what you typically hear when people come in with hip pain that winds up being labral tears. It's not usually that they had one event. They weren't out for skiing and they hit a mogul, or they were not playing football and they got tackled funny, like you would hear maybe in an ACL tear or a shoulder dislocation or that sort of thing. People typically come in and they say, I've been having pain in my hip for the last 6 months or the last year or the last 3 years. I feel like it's a lot of groin pulls or something along those lines. That's kind of a common misnomer for potentially having some labral pathology in their hip. So it's usually a little bit of a longer, slower kind of chronic process than an acute process.
That's interesting because, as we get to Tuukka Rask now, as you mentioned, he, in his exit interview the other day, he mentioned that he thought that he suffered this injury last year in the bubble in the playoffs, which, if I can wrap my mind around when that was again, that was kind of late October, I think it was, roughly around there. So that kind of hits that timeline of maybe 7 months of chronic pain and something that he's been dealing with. And in the beginning of the playoffs, his movement was kind of questioned a little bit. And that makes more sense that, with the slap tear, for me, I couldn't lift my arm above my, this level here. And I knew something was completely wrong and it wasn't I could work through it. But I guess the question for you now is, you mentioned that hockey players see a lot of labrum tears. Is that because of the movement of skating, kind of that lateral movement versus I don't know what you would call it, a forward, just a normal running movement?
Yeah, that's a great question, Matt, and that could be the topic of a whole nother Zoom conversation on of itself in terms of what causes particularly these cam lesions. And yeah, there's actually a lot of data to suggest that sports that have external rotation of their leg and of the hip tend to cause a higher incidence of cam lesions than do sports that are much more require just inline activity. So, for instance, I was part of a study during fellowship out in Vail, Colorado, where we compared very high-level hockey players that were kind of these are all males that are from the ages of about 14 to 18. So right through their kind of peak growth spurt, their final growth spurt before they hit skeletal maturity, to very high-level competitive skiers who are just, alpine skiers skiing downhill. And the incidence of cam lesions in the hockey players was 8 times higher than that in skiers. And again, these are both very competitive athletes. They're both working out a tremendous amount. Those similarities have held true. For instance, soccer players have a high percentage or a high incidence of cam lesions as well because of the external rotation of your foot when you go to kick a ball. Breaststrokers more so than freestylers. Like I said, hockey players more so than runners, than cross-country runners or something along those lines. And one of the theories is that external rotation causes stress right on the ball of the femur, the ball of the hip socket, right when the growth plate is closing. And that growth plate is pretty weak at that time. There's other conditions in the hip that involve that growth plate slipping or fracturing through that growth plate. And one of the theories is that that cam lesion, that extra bone, is the body's attempt at trying to stabilize that growth plate to prevent it from slipping. And as you bring the hip into external rotation, you increase the stress through that growth plate. And so that's what a lot of the theory behind why these cam lesions tend to occur.
Interesting. So that makes complete sense now when you hear about a bunch of kind of famous athletes and what they're doing, soccer players, hockey players, and they get these hip injuries. I mean, one of the most famous hip injuries ever was Bo Jackson, right? And granted, he wasn't a hockey player or a soccer player, but that kind of lateral movement that he was very famous for, I can kind of see that, or like that rotation we get involved there. Just a few more questions for you. So Tuukka Rask, just specifically to him now, he was taken or removed from Game 5 this year for what the coach called maintenance. And for my kind of just junior research on this is that hip labrum tears are affect you when you're sitting, when you're standing, when you're just lying down. Do you think, and again, you're not the team doctor or a hockey coach, but would removing somebody from a game for 20 minutes earlier than they would would that have had any effect to increase the level of injury that somebody like Tuukka Rask could have had for that next potential Game 6? Is that something that would make sense?
Yeah, obviously it's a little bit hard for me to say, and not being there at the moment, and I'm not going to question, whether the coaches or the team doctors, decision to do that. As we said, this is likely an injury that's been going on for some time for him, and he might have just had a moment where he really had an acute flare up, and if that's the case, yeah, then kind of moving him out of that position and allowing him to relax his hip a little bit, perhaps that would have increased his ability to play at some point within the next couple of days. But it's certainly not going to be curative in a short period of time like that.
Yeah. Okay. And then, so for an injury like this, can time fix this, or do you need to have surgery to fix the issue? And then I guess the next question is this something that you would want to live with pain-wise for the rest of your life if you didn't have it surgically repaired?
Yeah, I mean, I think your second question really gets to the heart of the matter. So the answer to your first question is no. These typically don't heal with time per se, but sometimes the pain will go away, particularly when people have a labral tear, but their bony anatomy is normal. In a situation, if somebody has abnormal bony anatomy, like I was describing in that cam lesion or the pincer lesion, then it becomes a little bit more problematic. And then the pain typically tends not to go away. And so the surgery is really done as much to prevent or take away the pain that people are having, excuse me, than to necessarily prevent any further progression of the tear or that sort of thing.
Gotcha. And for Tuukka, so the last question, for a normal person, what would be a legitimate timetable after surgery that you could kind of get back to doing your maybe like everyday activities or like kind of weekend men's league hockey or whatever?
Yeah. So I in general, it's somewhere on the order of about 6 months. Obviously, it depends on the patient's level of fitness going into surgery. It depends on what the activity is that people are going to be participating in when they come out of surgery. And it depends a little bit on the condition of the hip when we get in there and we fix the labrum, and particularly also what the condition of the cartilage is. The cartilage is the smooth area of the bone, kind of like when you break a chicken wing open, you see that bright, shiny white surface. That's the cartilage that allows your body, the joints in your body, to move around freely. And if there's cartilage injury and cartilage damage, then that portends a little bit of a worse diagnosis and potentially a longer time to recovery. But on average, somewhere around 6 months before you're able to return to kind of high level sports activity.
No, that's perfect, because that's kind of the timetable that Tuukka Rask himself has said, January, February-ish of 2022. And again, we don't, and you don't know the severity of the injury or the exact specific of the injury, but in your opinion, you think like that injury would be a 6-month-ish time frame. So I guess he's right on board. And from what he's saying, it sounds like this is exactly what he's facing here. So so maybe Bruins fans or people in Finland might be seeing him in January or February coming up. But
Yeah,
so that's
I think that's certainly potentially realistic.
great. And so that's all I have for you for questions for this at the moment. And maybe we'll get back together a little bit when Tuukka, or if Tuukka comes back from this injury, to talk about potential, maybe re-injuring that or things or ways to kind of avoid it in the future. But I want to say thank you for your time here, and we'll catch up with you in a little bit.
Sounds great, Matt. Thanks for the opportunity.
You got it.
Take care. Have a good day.
You too.